Hello and welcome to our podcast. We're so happy to have you today. My name is Jackie Walker, one of your co-hosts, and I'm here today joined with your other co-host, Mr. Tyler Downey. Today we are going to be having a really powerful conversation with two amazing women. We have both Edith and Fritzie joining us today, so we hope you'll stay tuned and get into this conversation with us.
Great. Thank you, Jackie. It's great to be here. I'm excited about this session. And yeah, just drop some suggestions in the comments and hopefully we'll come up with a name soon. But really excited to be part of this conversation with the fabulous, amazing nurses that we have joining us today.
Absolutely. So I want to take this time to introduce our nurses. First, we have Edith. Edith, say hello.
Hi, everybody.
Edith, you're a registered practical nurse, right?
Yes, I am.
Awesome. Thank you for joining us today.
Thank you,
I
Jackie.
know you had to move some mountains to get here, so we appreciate you coming to share. And Fritzie, welcome to the show.
Thank you so much for the invite. I'm so flattered and humbled to be here.
Okay. Well, I think you both have stories and experiences that our members and the public need to hear. Because for me, you've inspired me, and I think we need to spread that around. So today we're going to be talking about healthcare, right? But more specifically, we're going to be talking about the role that registered practical nurses play in healthcare and how they've been working separately and together to make it better through politics. So politics. Why do you guys get involved in politics?
If not now, when? Yeah.
Okay.
When you hear politics, people think it doesn't affect you, but it does in so many ways. If you look at especially what's going on right now, politics plays a big role in our lives, whether we want it or not. It determines what you eat, where you go, where you live, your healthcare, for example, which is huge. So it's important for all of us to, take a look and contribute when called upon.
Fritzie, is politics something that you have always been excited about or cared about?
Something that I have avoided for so many years.
Okay.
Every time my previous steward will speak about, hey, come to the union, join us with this one, with the movement, I would always say, no, I don't want to go. But as I, continue working as an RPN and my previous steward had left, I realized that, yes, it is affecting everyone. And eventually it come to a point where, yes, it directly affect my family too. So this past 3-4 years has been a little bit more of fast track with me, catching up with what's happening. And I am learning to join little movements and looking at SEIU on what you guys are doing and giving my little contribution one day at a time. So that's what I'm trying to do. That's why I'm here too today.
Okay.
There was a moment in time recently for RPNs where the Ontario government sent a message to you all as RPNs and nurses generally. But I want to talk about that for a second because I think it's important and it's right in line with the question about politics. The $5,000, right? They decided that to recognize your work and recognize your efforts through the pandemic, that they were going to implement a what should we call it?
I think they call it a thank you pay.
Thank you retention pay. Thank you. What message did that send to you as an RPN and just RPNs in general that you work with?
I don't know if I'm allowed to say this, but I feel it's a crumb. It's something that was given to us for us to stop for a little bit on speaking up. It had reached me personally, but it was almost nothing. Like the first tranche was 2,500, I believe. And by the time it reached me and the other RPNs, it's 1.4. But even if you get the full 5,000, it's not what it is. Like we are more than that. I'm not sure if I'm bragging, but I feel that we deserve so much more than what that 5,000 was, or 1,500 and 1,500 is. We had worked so much, and even prior to pandemic, we've been always working so hard, and there is a lot of load that we are taking in that nobody sees. So for that simple thing, like, I feel like it was just a slap on the face. And I'm speaking up in terms of all the other RPNs that are here in Ontario.
What about you, Edith? When you got that whopping announcement, what did you think?
Well, I think for them to recognize and give us the 5,000, it means they understood that there was a lapse in whatever enumeration RPNs get. If that wasn't the case, they wouldn't have given the 5,000. So it was a good start, but I wish they took a step back and looked at ways of improving how RPNs are paid, because what RPNs earn, especially in Ontario, is not fair. If you equate what RPNs do versus what they earn, it's sad. A lot of RPNs are struggling. Even before the pandemic, they were struggling. The workload has gotten, the workload has increased. RPNs still have to do more, and yet our earnings stay the same. I feel the government should take a moment to listen to what RPNs say, so they understand where we are coming from. We are not just saying this for the sake of speaking. We are saying it because it is real. We do work hard, and we need to be appreciated for the work that we do. Yeah. So pay is just one thing. There's a lot of areas that need to be taken care of as well. But pay goes a long way to take care of us, so we can take care of the vulnerable community.
Edith, you talked about the government should listen. And I think back to a few years ago now, you went to a lobby day with the registered practical nurses.
Yes, I
SEIU.
did. Yes, I did. It was my first experience going to an event like that. I was excited, but also a little bit skeptical once I got in, because I didn't feel like most of the people who were there at the event were even, interested in listening to what we had to say. There were a few. I don't want to name names, but...
No, we can name names. I remember your first meeting was with the Minister of Education now, Stephen Lecce.
Yeah. And in that meeting, there are a few of us who spoke, who were able to speak, but I didn't feel that all of us had a chance to air our opinion in that meeting.
But you had other meetings too. You didn't just meet with one MPP, right?
Yeah, gladly. I did have another meeting. The next... MPP, was she? That we spoke to was kind of, she was welcoming. She, it was a warm and comfortable environment, and she took her time to listen to all of us. Yeah, so we felt like somebody at least was listening this time. Yeah.
And so for someone like when you're first going lobbying, you're just like, oh my gosh, I just share my story. But I remember, and we talked about it, that your first meeting was with a conservative MPP.
Yeah.
And your second meeting was with
NDP.
NDP MPP, right? It was Franz Jelinek. And so I thought when you said that to me, the first meeting was hard. He didn't listen. He only talked to one person in the meeting.
Yes.
That there's a difference in who's listening and who's not listening. You know what I mean? When it comes to that retention bonus, some people were listening, and some people were like, let's get a bandage for this wound.
That's how it felt like. Yeah, I felt like we were wasting his time, kind of. I'm sorry if I'm rude, but yeah, that's how it felt. He just wanted us, in and out kind of thing, while we were there waiting for so long just to, have him, speak with us. So that, frustrated us a little bit. Yeah, but I know next time, if I were to get a similar opportunity, I'll try whichever way to say something. Yeah.
Some people would say RPNs should just be happy with the $5,000, right? Some people would say you're paid well. Some people say, why are you complaining so much? Some people would say It's the job that you decided to take. Some people say the government has done plenty to recognize. What would you say to those people?
I tell them to come and visit a long-term care and see what is really happening. Or if they have a loved one that is in a long-term care right now, to come and pay a visit and talk to an RPN and ask what or how their workload is for the day on a regular basis. Because there are plenty of things that they don't see, and we do commit ourselves to work and complete the task and take care of our residents on a daily basis. And they don't even know what we are going through if there is a short staffing issue. If there is a short staffing issue in one department, I'd say PSW or dietary or recreation, the load goes back to us because we have to carry the load as well. If there is a resident that is physically or verbally responsive, or even any other behavior that can cause them into be in the danger, imagine if that's their loved one. We are taking the full responsibility for that resident to be safe on our shift. And we have to take that because it's part of our duty. And we don't want them to be on a position wherein at the end of the day, they get injured and they will say, okay, it's your fault or anyone else's fault. It doesn't matter whose fault it's going to be. We don't want them to be on that situation. So I would tell them to come and visit a long-term care. And they will see exactly what's happening.
How about you, Edith? What would you say?
Say similar sentiments. I'd tell that person who's questioning, come, welcome to my world. Come when I start my shift and please stay until end of my shift. And my day today is different. Today may be blue, tomorrow may be green. I'm not guaranteed a blue day every day. In short, I just want to say, RPNs do a lot of work. I'm not saying it just because I'm an RPN, but I know what I do, and I can guarantee you it's not an easy work. I need to be okay physically, I need to be okay mentally, socially, everything you can name it, right? Because if I'm not okay in those areas, I'm not going to be able to do my job to the best of my satisfaction and to the best of your loved one's satisfaction. So take care of me. If you take care of me, I will try do my best and take care of your loved one.
I mean, I think that's fair, right? I think, the other question, I don't know if you mind, Jackie, but I want to kind of, flip the script a little bit here. Why do you care? Tell people why you care. Why do you care for others? What drives you to care so much about others?
We are in nursing profession, not because of any other reasons, like not because of money or anything. Like for me, in my own opinion, like all people, we all have our degree of caring within our family, within our community. But with the nurses, there is that extra spark that gives us more, like that is within us. That's why we are in this profession. And although we wanted to keep that spark with regards to this work overload that we are having, it's hard for us to give that care anymore because of the short staffing that we are experiencing. But why do we care? Because it's our nature. It is everybody's nature. Maybe there is a little bit more within us that is there ever since, but it's us. That's part of our personality, and we wanted to just extend that to our residents.
Why do you care?
I care because my workplace is like second family. We stay there like most of our, most of the day. That's where I spend most of my hours. So when I meet my patients, my residents, they're like, my family. I'm happy when they're happy. I'm happy when they're healthy. I'm happy when they're taken care of, when they eat, when they take their medication. Why wouldn't I be happy? So, of course, that's why I care. If I don't care, then I would not even show up for work. Yeah. Another thing why I care, I would be a resident just like any one of them. I would love somebody to take care of me. So I feel I'm not there by mistake. I'm there because I'm supposed to be there. So I don't want something else interfering with me being there and doing my job. Yeah.
Right.
Do you think that's common to both of you? Do you think that's common for a lot of people who are nurses?
With what I
reasons why-
see in my
yeah,
home, yes.
Yeah.
I see that, and I feel that from my coworkers,
Mhm.
my fellow
Okay.
RPNs. Even if they're already saying their concerns, you could still see that the deepest part of them is caring for the residents. And that's what's breaking us right now, because we see that they don't get what they deserve. So it's not just like, yes, we are overloaded. It's also because they need more. Their care is much more complex right now compared to years back. There's so many things that have been going on, and they have so much diagnosis that have added to their situation. And even if this could have been something that can be taken care of in the hospital, they get moved to us very quickly. So that's the reason why the staff in my home is so much care, very caring.
What's the impact on you, both of you, for knowing that you wanted a blue day where you could, do it all, but it's a green day and like your plans are gone? What's the impact on you knowing that you couldn't do it all?
The impact can be great. It can go either way. It can lead you to being motivated, or it can lead you to want to give up, unfortunately. But at the same time, when you listen to what, the feedback you get from residents, their families, about the work that we do, about how they feel, what they think about, our services, it makes you happy. It makes you want to go again and not give up. So all we are asking is for support. We've been talking about same things over and over again, but like Jackie said, the government seems to be putting a Band-Aid. We don't need Band-Aid on these problems that are real in the long-term care and hospitals and home care, for example. Yeah, issues are different, but most of them are common issues. So if the government would just, take their time and make the necessary changes to make healthcare better, I think it would make the lives of RPNs also better.
Do you think all of those government announcements, more PSWs, right? Wasn't there all these announcements over the last 2 years to invest more into long-term care, thousands of PSWs getting trained and educated, thousands more nurses being put on the front line, more money for development of new facilities to increase beds and access? Have you seen any of that trickle down to the work that you do in terms of supports on the front line yet? Have you seen?
I have seen slight changes in my home. This year, 2023, we have started 2 full-timers on each shift. So 2 full-timers on day shift, evening shift, and night shift.
Okay.
And those are permanent lines. And I was informed that that's from the Ford funding. It helps. But for me, it's still not enough. There's still a lot of things that needs to be done. There are still a lot of vacant lines that needs to be filled. And what's happening is they say, yes, we're posting it and we are looking for people. But what happens meanwhile that we're still, we still have waiting for those applicants to come in, or they're still trying to pick. We are still short-staffed. And there's plenty of things that needs to be done. It is a good start. And I'm thankful for those 6 full-time lines that came in this year. It's a big help, but it's not enough.
Still far from
Yes.
where you need to be. How about you, Edith, in your workplace?
My workplace has stayed the same. I don't want to say that I've noticed any major change from what the government announced. But what I'd like to say is, let's not overload the current employees we have right now. Let's take care of them so they can want to stay longer and hopefully build up on what we have. Because if you keep doing what you're doing, which is not working, a lot of people are going to leave. Some will come and they will not stay. So what's the point? You will be replacing those who are leaving, And it just goes, from point A to point B, and the circle continues. So take care of who you have right now. Make them, I don't want to say comfortable, but make the work doable so that it can invite more people to join the profession. That's what I
What would those things be? If you had the opportunity to make the changes necessary, what would the top 3 things be that would change how people stayed or decided to leave? What would those things be?
You want to go first?
My top 3, I would say staffing, pay, and respect. Because you could have one amongst those 3, but it's still you can still feel the difference. But if you have those 3, I think it would be a big impact. People would want to stay. People would want to work on where you are, especially with respect. I have seen so much with this word, and it's not even something that I wanted to go in detail with because it's very upsetting. It is saddening. And it's not just because it's happening within a certain part of of Ontario. It's because I've seen it happen in my home as well. So for me, short staffing is a big deal. If they increase the staffing ratio, if they give us the pay that we've been asking, we're not asking too much. We're just asking for what we deserve. And if we have that respect that we've been, we're not looking for it. It's just something that we've been missing for so many years. If we have those 3, a lot of people would want to come and join us. And we need more nurses.
What is it for you, Edith? What are your top 3?
My top 3 in any order would be staffing, definitely, pay equity, and safety. Safety, including sick days, paid sick days. Because I've seen a lot of times, sometimes people show up for work sick because they cannot afford to stay home. They come to work sick and, put themselves more at risk, working sick. And so, they don't do their job as well as they should have if they were okay.
When you're saying people, sorry to cut you, you mean nurses?
Nurses come in, yeah. Because
nurses that you work with don't have sick days.
Yeah, part-timers don't have a lot of sick days. If somebody has COVID, for example, and you're not on outbreak, it's not covered. So tell me how you're going to pay your bills staying home 10 days. You'll think about that and just say, you know what, I'm not sick, and yet you're sick. So it puts everybody at risk, including you, the sick person.
There's this Advil commercial, and it's like a mother, and she's in pain. And the Advil commercial says, take the Advil for your kids who are in pain. And when I watch that, I'm like, this is a shame. Women in pain who are sick, like the nurses, they should be able to stay home if they're sick. But that's like, you're a woman. Just take a pill, have another coffee, and get to it. Doesn't seem fair.
The first day you'll take Advil. The next day you won't be even, able to take the Advil. You might need 10 Advils, right? So why should we wait for it to get there? Yeah. So this government should listen to what these are real problems that we have.
And you have some real solutions.
Some people would say though that pandemic is over. We've gotten past the worst of it. We've moved away from people dying and. It was really chaotic, right? There was a moment for a couple years there that it was chaotic. Now people are back to their normal lives, going to malls and having meetings in person and, right? Nobody's wearing masks anymore. So a lot of people would say, pandemic is over. What are those nurses complaining about? What would you say to those people?
Pandemic is over. That part of infection control protocol might have been over. We still have a lot of infections that are going through. We have the flu, we have gastro infections, and on top of that, we have these residents that needs help with their care. And the complexity of each resident is different. We have residents who have severe dementia. We have residents that are walking, but they don't know what they're doing. They're wondering. We have the age of residents going into a nursing home right now is getting lower and lower. We have residents that is like 40 something years old. And those are something that they don't consider. These are residents that are walking, and if they have dementia, there is a risk of safety for them and the residents because they don't know what's happening. They need more monitoring. They need more help. And on top of that, we also have the residents who have more complex care, that had a stroke or sitting on a wheelchair. They're fully cognitive, but then they need help in going to the washroom. They need help in feeding. And those are just basic needs. And it's sad to say some of the basic needs were not met in many ways because we don't have staffing.
Are you talking about during the pandemic or like
It is both.
both?
Yeah. We had it prior to the pandemic and we still have it till now. So that's what we are going to present. Like, COVID is done. The problems that we had prior to COVID, it's still here. And these are things that the residents would have until the end of time. We are there to help them, and we are there to take care of them. And we cannot do that if we don't have the enough staffing that we need.
How about you, Edith? What would you say to those people who think it's over, stop complaining,
I'd say, pandemic is not over. It's not. Because, we still see the side effects of the pandemic in the workplace, in public, life. Especially in the workplace, we still get, cases of COVID once in a while. When we do have a case, it affects the whole building. So it's not that it's done. It may have just eased a little bit, but it's still here.
So, one of the things that I think we should really dive into here, Jackie, is the distinction between an RPN, a registered practical nurse, and a registered nurse. Because, so I'm just be honest, I've never been a nurse. So I have family members who have been nurses for 30 years, aunts and family members who have been registered practical nurses. But many people don't understand that a registered practical nurse does pretty much the same job as a registered nurse, but gets paid significantly less. Is that right? Can you talk about the difference between the work you do? And we're not trying to, discredit registered nurses. They're important and they're valuable. What I think we're trying to do is highlight registered practical nurses and your contribution and how much you should be more valued in the healthcare system. So can you talk a little bit about the work that you do in comparison to the registered nurse?
There's two things. One is resident care, and one is being in charge of the building. So where I work, we have a charge nurse in the building, and the charge nurse would be responsible for filling in a shift if somebody called in sick, checking each unit if they are safe, making sure all the doors are locked, making sure that there is this safety within the home, whether it's chemical safety or physical safety. With regards to resident care, there is not much difference. We are doing admissions, we are doing readmissions, we are doing all medications, we're doing wound care. We are monitoring each fall. I am doing doctor's rounds because I don't have an RN in my unit. I have an RN in the building, but they don't come in and help us with my rounds. They have to do their own rounds on their floor. So I'm doing rounds twice a week with the doctors. So the only difference that I see right now is the management part of it. In terms of taking care of the building and the residents and looking at what's happening. And
there's a significant pay difference, I would imagine, right? I think we're talking probably some cases $20-$30 difference per hour, right? How about you, Edith? What's your
So nothing against my RN, colleagues, but the main difference is they look at the numbers. The RNs are supervisors of the whole unit, wherever they work, or building, whatever may be. But the main people who do, the little bit, medication assessments and stuff is the RPNs. So they are our supervisors, but what they feed on is what they get from us. And when they're not there, we do everything that they do.
Yeah,
so I don't understand why the pay disparity is so huge between RPNs and RNs.
So what do you mean when they're not there? Can you both give me an example of when the RN's not there?
So we may have situations where, depending on where you work, we may have situations where every floor has an RN. There are situations where there are no RNs on all floors except one. So then they're in charge of the whole building. But the RPNs are the ones who take care of the units in their absence. Okay. So if you don't give them the information, they will not even know what's going on. I'm not trying to put blame on them. I'm just saying, we do most of the work.
You fill in when they're not there. And then, wow, if three RNs aren't there, that one RN is like trying to piece together the work of all.
Of all, yeah.
What about you, Fritzie? Like, when is there not an RN in the building? Or
there's always supposed to be an RN in the building. In my shift, there's always 2 RNs. One is in charge, the other one is in charge of the floor. In my unit, I don't have an RN. So if I have an emergency, that's the only time I'll call an RN and say, look, I need a second eye. I need a second judgment for this. Am I sending my resident to the hospital, or could this something that I can, take care of within the unit? So they will come down and look and say, yes, you need to send a resident to the hospital. Let's call the doctor. But eventually, I'm going to be calling the doctor. It was just that second eye that I need. But on a regular basis, if there's no emergency, I take care of everything. I have to do all the wound care, all the medication. If there is a new admission, this was a practice that had developed with us about 4 or 5 years now. Okay. Now they come down and take care of the admission medication reconciliation. It's something that we've been doing many years ago, but because we are very overloaded and we had brought this problem to the management, they had decided that yes, okay, RN will come down and do the admission process for the medication only. Okay. But all the other admission assessments is still on us, the RPNs on the unit.
And that's something that you were doing 4 years ago, but because you spoke up, they said, let's share the work?
Yes.
Okay.
So is it safe to say...
It didn't start from me. It started from the previous RPN chief steward that I had. Okay. She's been here and that continued until now. So I'm thankful for that.
Okay. Great. Yeah. Somebody did the work ahead of you to try to make sure that you weren't drowning on an admission day.
You say we can do it, but we don't have the time. We don't have any more time for this. We need to be on the floor taking care of the residents. So this new admission assessment would take us about at least 30 minutes or more. It needs to be passed on to someone else. It's not doable with the 7.5 hours, 8 hours that we have.
Is it safe to say that an RPN, a registered practical nurse, does 90 to 95% of what an RN registered nurse would do? Is that fair to say?
In long-term care.
Yeah. So I wanted to say, in hospital, it's different from long-term care. Yeah. So we do have chronic cases in long-term care, but the level might be different from that of the hospital. So like a long-term care, you still have to use your critical thinking. Yes. Yeah. You don't just go call an RN, I have this situation, blah, 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 blah. You will still do your assessment and determine, what level of care your patient needs. It takes you time. Meanwhile, your other work is waiting for you.
That's right.
Nobody is doing your med pass.
That's right.
You have so many people to give medication to within a certain number of hours, right? So when that time passes, you're lagging behind. So you are rushing to take care of this patient. In the back of your mind, your medication is waiting for you. It's not easy. Imagine going through that 5 days every day. Yeah. It's taxing. Yeah. And then you there's some point you just say, you know what? Do I continue? What do I do? Yeah. But we always continue anyway. We go back. All we are saying is, just appreciate what we do. Yeah. RNs are RNs, yes, but RPNs are also, important.
Yeah.
So what's the number for you? What's the number of overlap? Kyla said 90 to 95.
Well, I mean,
Or
I'm
is
just
it
throwing a
95 to
number out there.
97,
I don't know. I just
Mine
I
would be
mean-
95 to 97.
I mean,
Because
Wow.
we do basically everything.
Yeah.
All when the doctors don't come in long-term care, or we don't have, a serious case
Yeah.
of anything going on,
yeah.
they're basically, supervising and monitoring us,
Mhm.
right? But, what I pick up on is what they feed on.
Yeah.
If I don't pick up on anything, a resident situation gets worse,
Yeah.
it's going to be harder for them.
Yeah.
So for them to, for us to do our job well, we need to be supported.
So you're
That's
really
all
the
we're asking.
nucleus
Yes.
of the home.
We are.
Yeah.
Because I honestly, I don't think any RNs, especially in long-term care, would even want to do a half of what we do.
Yeah.
Nothing against them. Like
Yes.
they
Yeah.
have their
Yeah, this is
workload.
definitely not a
No,
them
no, it's
versus
not.
us
No.
conversation.
No,
this
no.
is really to highlight,
No.
because it's been a thing, right? It's been a thing for a very long time, and we haven't really talked about it in any meaningful way. And I think what we're doing today is we're bringing it to the surface.
Yeah.
And we're saying there is a distinction
Mhm.
between what an RPN does, a registered practical nurse does, and a registered nurse
Yeah.
on a daily basis.
On
and
a
we need to
daily
talk
basis.
about that more often.
Yes.
So
On a long-term care, yes.
yeah.
And it's the same way. If you have an RN sitting here and ask the question, what is the difference in a long-term care? What is the difference on the job description and the responsibilities,
Yes.
duties for the day? They would say, I'm doing a lot of RPN duties as well. If they are short-staffed, if they are missing one RPN, they have to jump in and cover for that line
Yeah.
too. So they're doing a full RPN duties. On top of that, they are in charge. So there's also that at the back of their mind, they are in charge. So it's the same way with us. If we are working with a regular duty and we don't have an RN in the charge nurse on our unit, we are given an extra load that the RNs are doing on a daily basis. So that's the overlap. And
So what's
there's
your
not
number?
much of an overlap.
What's your
I would
number?
say just 5% difference.
Wow.
Okay.
Yeah.
Okay.
You know, the other thing, Jackie, that happened recently, I just want to bring to light and I want to get your feedback on is personal support workers. There's been a lot of announcements for them in the last, couple years. They got the $3 pandemic pay that has continued on. Well, it's permanent now.
Without a fight
Right.
from the union, it wouldn't be permanent.
Yeah, well, that's
Right.
that's true. I mean,
Yeah.
it's important for them to be recognized. But when in relation to the registered practical nurse, the federal government just recently announced $1.7 billion to make a $25 minimum wage across the country for personal support workers. And so I'm always wondering, how does that make RPNs feel, registered practical nurses feel, when they see those type of announcements?
I feel like we were left behind.
Mm-hmm.
I'm happy for the PSWs. They deserve it. But we also deserve what they are getting right now. So with regards to the responsibilities that we are doing, the pay is just not aligning at all. Not even close, honestly.
How about you? Edith? Are you're
Yeah,
thinking over there?
I'm very happy, very, very happy for the PSWs, but I think we feel left out, like she said. Why would they just pick PSWs and leave, RPNs? Like, what fairness is that?
Yeah.
It's not right. Yeah, it's wrong, because their pay ladder keeps climbing up, while the one for RPNs is stagnant, and while our RN counterparts, they get the big bucks. Yeah, so they should get their bucks. We get ours, and the PSWs get theirs too.
And it seems like the registered practical nurses are being left out, because I think what
Yeah.
you just described is really what's happening. So registered nurses
We're
are
left
getting
only in the middle.
something, right?
Mm-hmm.
You've got PSWs, personal support workers, getting, and the registered practical nurses in the middle,
Yeah.
not getting anything. Is that
Yeah.
accurate?
It's like us, we are going backwards, but
Yeah.
everybody else is climbing upwards. Yeah.
Yeah,
So it's sad.
yeah.
It's a noble profession. Like, we need RPNs. So give them what they deserve.
Yeah. Do you ever think about leaving the profession due to what's happening? Does that ever cross your mind?
I told my family and my friends, I think I'd learn how to bake a cake and cupcakes, and I move on and move away from nursing profession. And I thought of that seriously. If not thinking about my kids who are in school right now, and I have a university girl who's striving, I would have moved away from nursing. So
how about you?
I can't, but
I don't want to lie. I thought about it, especially after the pandemic. During the pandemic, yes. I said, because I brought COVID home and I saw what it did to my family. I sat aside and said, is this fair?
Yeah.
It's not fair for me. It's not fair for them. But then, I told myself, actually, I had spoken to my dad, and I don't know if I'm supposed to say this, He was upset. And he didn't talk to me for a couple of days. And then he called me back and he told me, you know what? You are there for a reason. Yeah. You're taking care of somebody that could be me, right? So, just be safe. Make sure you guys have the, PPEs, the right PPEs, and then leave the rest to fate. And that, it kept me going. It gave me some hope. And I told myself, you know what? Let me just do it. Yeah.
Wow. It's like above all the odds, because I'm hearing external pressures, right? Like other than you yourself, like your children, you might rather be baking a cake, but you have to provide, and you have not the pressure, but the push from your father to say, like, remember why you're here. Through all of this, you both stayed. You're both still amazing registered practical nurses. What helped you stay in it and not walk away when you felt that?
because there's not much of us. Like in my mind, if I do leave, there are still nurses that would stay. But if the other nurses' mindset is my way, I'm gonna leave, who would take care of the residents in the long-term care home? Like, who would take care of the rest of the patients in the hospital? And also, there's not enough RNs too. And PSWs would be there, but they still need their medications and their wound care and whatnot. So we need an RPN in the community. And on the other side, I feel like there's something that can be done. We will continue speaking up about it. If we continue to speak up, even just increments here and there, and tell people what's happening, and just tell them, come and visit, look at what's happening, look at the job description that RPNs have to do, and look at all these things that the RPNs are doing for your loved ones, then they will realize that yes, there's something that can be done. And perhaps they will realize that there is really something wrong with the pay equity that RPNs are receiving right now. And there is a huge problem with the staffing issue that we've been telling for so many years, and it has gotten worse by the pandemic. It's just too much.
Hope that something can change.
I have that hope. I'm not losing it.
Yeah. That's important. Hard to muster sometimes, but what about you, Edith? Other than your dad saying, suck it up, buttercup, why are you still here?
I love what I do. It gives me fulfillment in so many ways, because I feel good when I know what I did made somebody somewhere, happy. And apart from all these things that, the government doesn't want to take care of, our residents are still, precious to us. Yes. Yeah. They're our second family, like I said. So why not? I'll keep going until that day when I know I can't go anymore, but
you've done
whether
your
the
part.
Government wants to listen or not, I'll not feel guilty for not doing my part. Yeah.
I've been thinking about this question, and I'm just going to pose it because I think it's an important question to ask in this moment that we're in for registered practical nurses in Ontario.
Thank you.
What is it going to take for the government, the public,
Thank you.
other professions to understand what registered practical nurses do for the healthcare system in Ontario? What do you think it's going to take?
It's tough.
I
We've
know-
been speaking about it for so many years.
Mhm.
A lot of the people, they know already what an RPN is.
Mhm.
And some might be like, they're not aware yet. They probably think like RNs, RPNs are still the same.
Mhm.
But I would suggest that if you are somebody who is in the community that is, like not interested with healthcare, please go on a website and look at the Ministry of Health policies about long-term care and see what are their expectations when your loved ones is in the community. Go into one of the most grand and richest nursing home in Ontario. There's a few of them, and ask for the policies and procedures and ask for the job description of an RPN. Then you will see how much load and how much heavy responsibilities we have for our residents. And it could be any of your loved ones in the future. It could be my loved one too. So it's something that is really needed in our country, and it's in the whole world. Like, we are needed. I'm not bragging, but we need nurses. We're all gonna get sick. We're all gonna get old. Who's going to take care of us? Yes, there would be PSWs supporting us, but we still need our medication. We still need to be taken care of. And there's still some things that, that organization wise in a unit that needs to be done by an RPN, so that the care would be done smoothly by the PSWs and other healthcare providers.
You mean like nurses doing care plans and doing
Yes.
a good admission?
Yeah, and doing referrals, reaching out to other departments, reaching out to other part of healthcare that can help each resident. Because it's not just nursing. There are other part of healthcare that we need in a long-term care, like pharmacy and occupational therapists, physiotherapists. So who's gonna lobby for the residents? It's us.
Mhm.
That's part of our job description, and that's something that we need to do for everybody, So that's the difference. That's why I'm encouraging them to look at it. Come and visit the long-term care and ask for the policies and procedures, and you will see exactly what needs to be done.
Good.
And what we are doing
Good. Thanks.
on a daily basis.
Edith, what do you think?
I can say things like this, podcasts like this, can make people more aware about roles of RPNs, especially in long-term care, which is huge right now. And, I'd encourage the public to ask the questions. If they really want to know, they will know what role an RPN does in a long-term care or in the hospital or home community. It's not just about pills. It's not just us giving pills. We have to make sure we're giving the right pills, right? And sometimes it's not only pills that we give. It's emotional support. We talk to the patients. We help them eat. We also help them dress. We help them to, with the toileting. So it's, a bunch of things. It's not only medication that we do, that people assume, our job is just, to show up, give the medication and go home. So I'd just like to encourage everybody to, take a step back and look at what we are trying to say and really see why we've come to this point. So, yeah.
Sure.
We have absorbed so much, even with families. We have families that are expressing what they feel, their frustrations, their feeling of, okay, my loved one is not getting enough care. And in terms of those frustrations, the first person that's going to receive it is us. And we're listening to them. It's basically, we are absorbing everything, resident emotion, family emotion, and that takes toll on us. That's why a lot of the RPNs in our community right now, we are dealing with mental issues that nobody or very seldom speaks about. So there are RPNs that are going through therapy, but they don't tell anyone. There are RPNs that are going into so much cycle of their emotions and their mental stability and their afraid to speak up about it.
Yeah.
And that's something that it shouldn't be happening. Why are we getting this one? It's because we are overloaded. It's because it's not because we don't know how to do the task or the duties and all the responsibilities. It's because we've been overloaded. We had it so many times, and we are given specific tasks that can be, it's just not realistic for the day.
Yeah.
And that's happening every day. In that increment of things that is happening every day, it takes toll on us after such amount of time.
Yeah.
The buildup. Why do you think nurses aren't talking about, getting help or needing help?
They're tired. I know they wanted help, and for me personally, I had reached out for help, for mental health, because I know I need it. I have reached that point wherein there was a turnover in my case, and I was talking to you about this earlier on about boundaries. I need to put boundaries, or else my body, my mind, my soul is going to give up, and my family needs me. My kids needs me. So I cannot just give up like that. I have to reach out and do something for it. And with that, it will also help my residents, right? So if I am healthy mentally, physically, I'm able to give care properly. But all these issues is an increment of something that has been going on. It's something that is hard to deal with, and the load is just really unimaginable. Like, nobody understands unless you come and stay with us on an entire 7.5-hour shift. And you will see we're staying there longer than the times that we're supposed to be there just to complete the documentation part. And if we ask for our overtime with our employers, they say, oh, you didn't have an emergency, so why are you asking overtime? What they don't realize is that's our regular load already. So it's something that is not doable in 8 hours.
The bare minimum is not enough. Is not enough. Oh, I think we were talking about boundaries before, and you shared with us, some of the ways like you were setting up boundaries, but you also shared about some of the things that you were taking to help you work through some of those struggles. So you weren't just like, yes, I'm tired, but my hands are up and I'll just go through the motion. Can you talk to us about some of those actions that you took I know you're an activist, I know you're a leader. What are some of the things you did to help you, deal with some of the struggles that you were facing that were making those incremental hurts to you?
I'll go two ways. With regards to the workload, we had started with the work overload form, and I have this much of a work overload form, and this was during the first outbreak in my home. So we presented that during the labor management, and we have shown that, and we had clearly established in black and white that we were overloaded. So that was the part wherein they started to look into hiring some more staff and realizing that, well, I shouldn't say realizing, they realize it ever since, but they're not doing something about it. So when it's put in black and white, it is more credible, and it's something that needs to be addressed. So in the past 2 years, I see some changes, and I'm happy with that changes, but we're not close to what we needed yet. And in terms of dealing with it personally, I'm, talking to my doctor, I'm contacting my therapist, I am taking all the benefits that I could get, my massage, my acu, and all those little things that, can help me at least sustain within the day, or at least help me relax and remove some of my stress. And spending time with my kids is a lot of, that's something that is precious to me, and I'm sure for everyone else. So I'm trying to do that as much as I could, because that's the best thing that I can do right now, just to go closer to the people that you love. And that's something that is very important to do.
Yes.
Not just for healthcare, but for everyone else.
Right. Edith, how about you?
I can just add, my personal experience is, before I used to be, they do it all, make sure it's done. Whether I feel, overburdened, I don't say anything. But, I learned a little bit about self-care, and I said, you know what, at some point, you have to figure it out for yourself.
Yeah.
You know so much, you know what you can take and what you can't. So I just tried to, reevaluate myself, reevaluate my schedule, my workload, and do what I need to do. What I don't need to do, I don't. Yeah. And when it was time for me to change jobs, I did, make a move and change. Because I felt like I was dying, what I was doing before. It was a very rewarding job, but really, really taxing. So I think I did my best. Yeah. And so I said, you know what, I've done my part. Let me move on.
Yeah. It sounds like you said no somewhere in there.
I did. Yeah. Because I felt like, I cannot, continue like this. Yeah. You just need to understand. And speaking is also good. I did speak up many times. Initially, nobody was listening, but I just kept speaking.
Okay.
Yeah. Okay. And then when I got a chance, I said, you know what? Thank you. So I moved. Yeah. Just, do what you can. Don't do what you can't. Yeah. There's a point where you tell yourself, that's it.
Yeah.
It doesn't mean you're giving up. You're just changing strategy. Yes.
That's my Bible. I put it in writing, even with what's happening. This is what's happening during the day. And it's something concrete that you can present the next day and say, look, this is what happened during my shift. Yeah. And I was not able to complete it. Could you give me, some time to do it? Or if you want, I can pass it on to the next shift. So it's sharing and putting that limit to yourself. You've done what needs to be done. You have some other things that came up that are not done for the day. And you have also taken on a lot of that in your shift already. So you got to put a limit to yourself and say, okay, that's it for now. And it's funny because my family notices it. My, like the load that I take in, like sometimes I come home late and they say, why are you coming home late? Because I'm not done with my documentation. I had to finish my documentation and it lasts me 30 minutes to 45 minutes to complete it. So that alone is something that I'm learning right now. I have to put a limit to myself and I have to continuously do that. I had improved. My 45 minutes staying with him before, now I'm staying just maybe 15 minutes more. But it's still that 15 minutes more. And it's not just me. There are other RPNs in my building that are doing the same thing.
It definitely adds up, right?
Yes.
Yeah. Have you done the calculator to see what the 15 minutes?
I don't even know the calculator.
I'm not trying to shame you, but it's like it's a lot for people to realize. Hey, it adds up. I remember when I did mine, I was around 1,800 hours a year, just from coming early and missing a break or two here or there.
You know what I really appreciate is that, and one, I want to just commend both of you for coming on and sharing what you shared today. But in my time in healthcare, I've realized that, and it's come out today, I think, in the conversation that we've had, that RPNs are really the true leaders on the floor in healthcare, when you really think about the dynamics that are at play and what you described today. And I think that's something that we just need to celebrate more of, but also recognize and use it as a way to really truly appreciate the role of the registered practical nurse as the leader in the healthcare space. And it's something that I think doesn't get talked about. So I wanted to just take that moment to just thank you both for being the leaders that you are and sharing what you shared today, because I think it's definitely going to go a long way. And hopefully the folks that are listening to this podcast session will take the time to do what you had suggested in looking at the policies and understanding what RPNs do compared to other professions in the healthcare sector.
And I'm really hopeful that folks who are registered practical nurses hear when Edith says, talk up and speak up, and you say, write it down. Because I think we're really good as nurses to talk amongst each other, even complain. But if we want to see real change, like you're moving in your workplace, we have to take it serious.
Yeah.
We have to hold them accountable and write it down. Yeah.
Yeah.
There's so much we can do, but I think it was you, Fritzie, who said like my small part. We all have a small part, and I think you both did a great job of sharing those small parts. And when we look at all of us together as registered practical nurses, there's thousands and thousands and thousands of us. If we all do our small part, that recognition is not going to be a fight, right? The celebration is going to be not just us celebrating us, it's going to be our community, right?
Yeah.
Other people.
Yes.
Your kids that you get to spend time with.
Yeah.
Any parting words before we go? What's the final message you want to share with folks listening in about, yourself, the role that you play as a registered practical nurse, maybe healthcare in general? What's your final message to the folks listening?
For me, I'd say we are here as RPNs by choice and by profession. So we are here, and what I encourage everybody to do is to come and see what we are doing in a long-term care, or come and check a hospital and see what is going on a certain unit wherein there are only RPNs, and look at their workload. And please, if you have a time, just go and check what are the job descriptions and job responsibilities of a long-term care, even in the public website of the Ministry of Long-Term Care. It's right there. Everything is written from one piece, from head to toe, from the things that we need to do from the time we come into the unit to the time we leave the unit. And we need everybody's help to realize what is really needs to be done in terms of the RPN sector. That's with regards to staffing and pay. I cannot even speak up the whole part of it because it's just too much right now. Like there's so many things that happened in the past that's just going through it in my mind one by one. And the bottom line is, and I have spoken to my fellow RPNs about it, like on top of my head, I'm like, what is your major concern? Just to juggle my mind for this, like the pulse. I'm trying to get the pulse of each one. And each of them had always been putting, number one, staffing. Yeah. We need proper staffing. And number two is the pay. Yeah. We need a better pay. We need to be at least on par with the other sectors in our healthcare. That's basically my.
Yeah.
Fritzie, I don't think people know, that RPNs in long-term care make far less than RPNs in the hospital.
That's right.
And then the RPNs in the community, they're all over the map, right? So that respect issue about the profession.
My third point.
Oh, then there's a difference between RPNs in private facilities like your facility and RPNs in the municipal homes,
Absolutely.
right? So it really is all over the map. But Edith, what's your final words for?
On behalf of my fellow RPNs, I'd just like to say we are not giving up. The situation may be dire as it is now, but we ask for your support. When you hear us call for your support, please do come out and support us so that we can continue this noble work that we do. That's all I can say.
Great. Okay. All right. I mean, I'll pass it to you, Jackie. It's been a great conversation. I think we've tapped into some of the real issues that are happening right now in Ontario with registered practical nurses. We heard from Fritzie and Edith on the working conditions. We talked about the variance, the large variance between the work that they do and the work that their counterpart registered nurses do. And we brought that to the surface, which I think is a helpful dialogue to continue to have. And the pay discrepancy that exists between the two and something that we just need to be honest about and not shy away from talking about, because if we don't talk about it, it's not going to change.
That's right.
Right. And so I really want to, again, commend Fritzie and Edith for coming on and sharing and just being honest about what's happening. So it's been great.
Absolutely. Thank you to our guests for joining us today, both Fritzie and Edith. You both brought up some really meaningful things that we as a collective, as a union, are going to continue to fight for, whether it's staffing, if it's ratios, and definitely the pay and respect that you deserve through your remuneration. That's what we have to stay committed to. And I'm so excited to hear from both of you that there is still hope. And I hope if you're a registered practical nurse or a personal support worker or a dietary aide, no matter what you do in healthcare, that you can feel that hope too. Because we've got a lot of work to do and we're not going to get it done if we're not all connected and united. So when you see, like what Edith said, when there's a call to action to participate in the Drive to 35, which is a 35 minimum universal wage for all registered practical nurses in Ontario, no matter where you work, we need you to get involved. We need you to send the letter. We need you to show up like Edith said, because we're not going to get this done unless every single one of us shows that we care for each other and cares for our residents and our patients. So thank you again for joining. Don't forget to share it, like and subscribe. If you have any information you want to share on the things we talked about, drop it in the comments below. I know Fritzie's going to be sharing some of those links in the comments. And hey, if you want to help us name this podcast, put that in the comments below also. This is our new union baby and we can name them together. So please do that. Thank you again for joining and we'll see you on our next podcast. Thanks.